Hello, I am Dr. Surekha Tiwari. I am a psychological counselor and a homeopathic physician. I'm based out of Bangalore and I've been here for the last 25 years. I've been in this profession for 35 years and it's been a beautiful journey. Bipolar disorders. Bipolar disorders, as the name suggests, it's a depiction of two extreme behaviors in the same patient who's going through this. On one end of the spectrum is almost manic behavior and the other end of the spectrum is depression. Now, if you look at the person in this manic phase, there will be extreme amount of energy. You do not understand where the energy is coming into this person. The subject does not sleep, does not want to sleep at all, is very unrestful, is pacing around in the house all the time, keeps on eating at various disturbances, and once he gets into the process of eating, keeps on eating. If he's exercising, you can see him exercising like absolutely nobody's business. And then would come the phase where the depression comes in and this patient does not want to move. Then the same person who was so energetic maybe a few hours before, maybe a few days back, suddenly goes into a phase where he doesn't want to do even his daily chores. Bathing is a big deal, eating food, getting up, talking to anybody, meeting people, having to do anything with his daily routine feels like a mammoth task. Bipolar disorder patients are very, very difficult to identify in the beginning because we do not understand the extremes happening in the same person. And that is why in a lot of disorders, it gets very delayed. And people of the family or those who are the immediate affected are very much confused to begin with, and eventually they feel very helpless. But I would like to tell all of you there, please believe me, there are lots and lots of things and methods and medicines which can help you. First of all, the red flags in bipolar behaviors should be risen when you find that these episodes, they take an extreme form to the extent that in a manic phase there will be abuse, there will be verbal abuse, there will be physical abuse, there will be absolutely no reasonableness or no logic to explain or stop their behavior. And then you find that the same person, again no logic, no reasoning, gets them to do things. Once you see this in any child or any adult, then you must think about consulting a doctor, talking to them before you take the patient to the person, so that you're able to observe and you're able to narrate better what kind of behavior is happening. Number two, in all these cases, I have always seen that a little degree of psychoeducation given to the attendant and the family helps us greatly. Once you understand what is happening to the patient, you start understanding the triggers which will bring on the mood. And before the mood sets in, A, you can protect yourself, insulate yourself. B, you can definitely make sure that the medicines are given in place. The third thing is a routine. In a bipolar disorder patient, if a routine is set that this is the time for breakfast, this is the time for bathing, this is the time for a little bit of puja, sitting down, it gives a structure to their otherwise erratic lifestyle. And those routines can be adhered to even when they have the lucid intervals. See, this is the term where I use where they may not be maniacal, they may not be depressed, they appear just like absolutely normal individuals. And in homeopathy, there are beautiful medicines to deal with this condition. There is a group of medicines in homeopathy which is known as bachflower remedies, which are useful for emotional disorders. And we have homeopathic medication like anacardium, like merc, which work wonders in this kind of a mercurial temperament which you see. But like any other disorder, you can have a kidney problem, you can have a liver problem. Please understand, it is as good as an organic problem of the brain, and we can definitely deal with it homeopathically.